Hi, I'm Taylor Huff. I'm Sonal Purekar. We are physical therapist assistant student at Carroll Community College. And today we're going to be showing you how to manually muscle test the gluteus medius muscle. So before we get into manual muscle testing procedures, let's review the anatomy of gluteus medius. So the origin is on the gluteal surface of ilium between the posterior gluteal lines just before the iliac crest. The insertion is on lateral aspect of greater trochanter. The nerve innervation for gluteus medius is superior gluteal nerve. The actions for this muscle is all fibers, AB duct, so it's a strong hip AB ductor. Anterior fibers flex and medially rotates the hip. Posterior fibers extend and laterally rotates the hip. And gluteus medius supports during the gait by producing rotation of the hip with assistance from gluteus minimus and tensor fascia latae.
If a patient presents with gluteus medius weakness, they will have a positive Trendelenburg gait. If you'd like to learn more, visit Kat and Jen's video on gluteus medius weakness on our YouTube channel. Manual muscle testing is used to understand the strength of a muscle or a muscle group. Manual muscle testing is performed to resist the force applied by a clinician isometrically, and manual muscle testing also provides the information needed for diagnosis, prognosis, and treatment regarding neuromuscular or musculoskeletal disorders.
In order to perform manual muscle testing, the criteria needed for the clinician are the comprehensive and detailed knowledge of muscle function, knowledge of joint motion, joint structure, origin and insertion of muscles, agonist actions, and palpation skills. So the manual muscle testing's purpose is to evaluate the strength of a particular muscle or a muscle group, and we also want to see how we can grade it, and it's graded based on its ability to move in relationship to gravity and resistance. So here is a chart where you can see it's 0 to 5. So I want to point out the one it's 2 out of 5, where the patient completes range of motion with gravity eliminated. The 3 out of 5, whereas the subject completes range of motion against gravity without manual resistance, and 5 out of 5, which means that patient can complete full range of motion against gravity with maximal resistance.
In order to test the gluteus medius muscle, the standard position is having the patient side lying and the test leg is superior to the supporting leg. The test limb is slightly extended beyond midline and the pelvis is rotated slightly forward. The supporting leg is flexed for stability. The therapist stands behind the patient and the test hand is placed on the lateral surface of the knee or at the ankle joint, and the other hand is just proximal to the greater trochanter of the femur. This allows the therapist to increase the moment arm. To test, the patient abducts against the applied resistance without flexing or rotating the hip in either direction. Resistance by the examiner is straight and downward. Example of instructions to the patient: I'm going to push down on your leg and I want you to resist me. So now we're going to pause and we're going to demonstrate this procedure.
So to test the gluteus medius strength, first as a clinician, I'll be behind the patient and patient is lying sideline, and I want patient to lift her leg on her own strength. Okay, as you can see here, she can do by herself. That tells me that her manual muscle strength is 3 out of 5, and she can do full arc of motion against gravity. To test the gluteus medius strength, my first hand will be on the proximal greater trochanter, and the other hand could be on the lateral side of the knee or on the ankle. So I want to give her mod resist to see how she is doing. and go ahead and don't let me push you down, and there you go. That's it. All right, so she's, as you can see, she can do 4 out of 5. That means she can resist against gravity. To test the maximum strength, I'm giving her maximum resistance and to see if she's 5 out of 5 or not. Okay, go ahead and don't let me push you down. There you go. Okay, that's it. All right.
If the patient is unable to resist gravity, we put them in a gravity eliminated position. We'd have the patient lying in supine. The therapist stands on the side of the limb being tested. One hand supports and lifts the limb by holding it under the ankle, and no resistance or assistance is offered. To test the patient, they abduct the hip through the available range of motion. An example of instructions to give the patient are bring your leg out to the side while keeping your kneecap pointed at the ceiling. At this point again, we're going to pause here and demonstrate the procedure. So if our patient is not able to withstand gravity, we can have them lying in the supine position, and what we're going to have them do is complete the arc of motion without gravity. So what we're going to do is we're going to have them bring your leg out to the side and complete the arc of motion. And as you can see, she could do it by herself. We give her a strength level of at least a 2 out of 5.
Why is it important to test gluteus medius strength? Well, it indirectly contributes to many lower extremity problems. Weakness in this muscle group has been implicated in conditions such as knee pain, patellofemoral stress syndrome, iliotibial band friction syndrome, hip pain. Physical therapists may identify the presence of these issues as a collapsing kinetic chain. Knee turns and bends inward like it's collapsing. And it's also, as you can see in the picture, it also increases the risk of ACL injury. Here are the references for the video. Thank you for watching our video.
And we are signing off.
Thank you.